Okay, so good evening, everyone. I am Archana Sharma. I'm the founder of Samvedna Senior Care, and we are meeting today after almost a couple of months. A lot has happened in this time, almost something which probably all of us never experienced in our lifetimes. And we hope that you and your families are safe and if you've had COVID, you recovered well. So this is our dementia support group meeting, which we hold regularly once in 6 weeks. And I have with me here Dr. Jayashree. She's my co-founder. She's a clinical psychologist, and her specialization area is Alzheimer. And Samvedna has been doing a lot of work in dementia care, as probably many of you are, have been probably attached with us or have heard about us. So we have some very special interventions as well as care services for people with dementia and their families. And the support group is a endeavor to also reach out to those who are not associated with us, but may have a lot of questions which need to be answered. And we also learn from each other's experiences in a support group. So this is the objective with which we set up the support group. This has been running now for almost 6 years. And and I know that some of you have sent questions, so we will be taking that up as we get into the conversation. So Jayashree, hi, how are you doing?
Hello, Archana. I'm doing well, and I hope everyone else is also keeping safe and doing well. Hope everyone is, everyone's families are also doing well.
Yeah. So at the start of this session, do you want me to put up our first poll question? So while people are still joining, I can see there are still people coming up. So would you want me to do that? Okay.
Sure, and maybe
So
before I just also wanted to mention that this is a support group meeting, and we are looking forward to receiving your questions and trying to answer as many as we can to the best of our capacity. This meeting is being recorded, and therefore, if you wish to ask your questions, you can directly type your questions into the chat box. Or you could also address them to the meeting host or myself if you wish to ask them anonymously. Yeah, Archana, you can go ahead.
Okay, so we'll just put up a first poll and we'll request all of you to please answer. And if you have any other answer, please put it in the chat window. Yeah, so here it is. I hope all of you can see my poll question.
So as a dementia caregiver, many people have mentioned that they've experienced a lot of challenges. And we want to know from you, as a caregiver, what have you found most challenging? Is it providing personal care? Is it keeping the person engaged? Is it working from home whilst caring for the patient? What are the challenges you are facing? There are many challenges, so please do respond to the poll. And if there are any other specific challenges which you've been facing, do share that with us in the chat.
Yep. So please do respond. I think this is important. And any personal question, observations, or any other answer you have, please type it in the chat window. Okay. So I'm going to end the poll. Is anybody else wanting to say anything? 65% have voted. So there are still people who are probably thinking about the answers.
If there are some other challenges which you've been facing as a caregiver, please do share that with us in the chat. And I realize there may be some people who are joining in who are not caregivers for dementia, and that's fine. So in case you're not comfortable with responding to the poll because you're not a dementia caregiver, that's okay. Okay. Archana, what have most people who have joined in for the meeting and are caring for people with dementia?
I'll just share the results, Jayashree. So I was just waiting that actually people are still joining in. So I was just hoping we could get a couple of more responses, and then we could it will just help us do a better discussion.
And in the meanwhile, if you've been facing any sort of challenges or you have any questions, you can just feel free to type them into the chat box.
So I'm going to end the poll in the interest of time, and please, these are the results. So Jayashree, I hope you can see the results.
Yes, I can. And I think we found that most people who have found keeping the person engaged most challenging. Okay, so we'll talk a bit more about this later on. But just to begin with,
is your screen shared, Jayashree?
Yes, can you see my screen?
Yeah, please go ahead, continue.
Great. So just so that there may be a couple of people who've also joined in who are wanting to know more about dementia, and just to get everyone on the same page, I'll just very quickly talk about what dementia is. This is a syndrome which is usually characterized by a loss of abilities that a person previously had in terms of their cognitive capacities. And this includes things like memory, their ability to learn new information, language. This also gets impacted, their ability to really comprehend dementia and that other people are saying to them. So their ability to comprehend language, as well as sometimes the ability to express themselves. And both of these aspects get impacted sometimes in dementia. And as well as their ability to judge what is most appropriate in situations, and orientation. And this really means the ability to understand where they are, whether it is day, whether it is night. So this really results in a lot of confusion. So as many of us as caregivers understand that one of the primary challenges that a caregiver faces as a person is very disoriented with respect to the kind of time, their surroundings, and the situations in which they are. So dementia is actually an umbrella term, and there are many types of dementia. Most commonly, the one that is spoken about, and I think which most people would have heard of, is Alzheimer's dementia. And this is the symptom which is most common in Alzheimer's dementia is a loss of memory. So the frequent symptom that we associate with dementia, that is the inability to remember things or learn new information as easily as before, this is a hallmark feature of Alzheimer's. And there are several other forms which are quite common. Frontotemporal dementia, where you see a lot of behavioral changes, Parkinson's dementia, vascular dementia, and just to name a few. So dementia is really a number of there are many different types of dementia, but the hallmark feature is that there is a deterioration in the person's intellectual abilities and the way that they were able to perform their day-to-day activities beforehand. It's a progressive condition, unfortunately, for which there isn't really a cure as of yet. So this means that the person with dementia, it continues to deteriorate across time, and the symptoms begin to get worse as the person becomes more and more dependent on others for basic activities of daily living, which include feeding, bathing, toileting, and these become quite challenging for caregivers as they provide care. Actually, we had another poll question that we wanted to share with people who've joined today. Would you be able to share that now?
Yeah, sure. Can you see it? I hope everybody can see the question.
Yeah. Yes. So we want to understand from you that during COVID, have you seen a deterioration in your loved one with dementia? So if you could just share what you have observed during this time period. We'll talk about some of the challenges that people have been experiencing during this time. So just mention whether you've seen a deterioration in your loved one with dementia during the COVID pandemic, from the time the COVID pandemic has really impacted all of us.
Okay, so I'm going to end the poll, Jayashree, and launch the results.
Sure. So almost 60% of people today here have noticed that there's been a deterioration in their loved one who has dementia during this entire pandemic period. And that's quite.
Any other comments? You can type it in the window. Yeah.
So please do share any questions that you may have as well in the chat box. In fact, some of the challenges that we've had a lot of people approaching us with during COVID that I thought we could just briefly talk about before we start discussing what some of the challenges you're facing are firstly the challenge of following basic COVID safety protocols. Now, although people with dementia aren't, who have dementia aren't directly at increased risk for the COVID infection per se, but the fact that they are unable to follow basic safety protocols or really understand and comprehend the importance of it puts them at greater risk. And one of the things that a lot of family members have really been struggling with is something about something as simple as maintaining hand washing or using a mask. So these basic safety protocols that we are now realizing are so critically important for all of us to follow. These are hugely challenging for people with dementia. And one of the basic obvious reasons is that sometimes they forget. They forget if we, for example, have to wash our hands. And this initially at the beginning of the pandemic was something that I think was hard for all of us to remember. And for somebody who's actually experiencing a deterioration in their memory abilities because of dementia, it's even harder. So because they're unable to remember that they need to wash their hands or they need to wear a mask, it's very important to use very frequent but gentle reminders about COVID safety. So, for example, if you are taking your loved one out to maybe visit a relative or something, then encourage them to either wash their hands or use a sanitizer where it's possible. It's important to provide this communication using very short sentences. And this is important because, as I mentioned earlier, a person with dementia experiences difficulties with comprehending what we are saying. And one of the ways to overcome this and to help them through this difficulty that they have is by using very short, simple sentences. Also, a lot of people with dementia just have concerns about wearing a mask. It's something that was challenging for us as well. Again, when a person is unable to understand fully why they need to do this, it's difficult. They may find it uncomfortable, they may find it tight, and because their ability to express pain and discomfort is also impacted, this is something that we need to be very mindful of. So ensure if you're asking them to wear a mask, make sure that it's one that's fitting well but not too tight. They may have concerns about not being able to breathe with it. So it's important to also show them that you're comfortable wearing a mask. And if they're in an initial stage and they're actually able to express the concerns that they have, it's important to try and understand these specific concerns. Another challenge that a lot of people have expressed is difficulty in communicating with a patient whilst wearing a mask. Now, this is something that I'm sure all of us have realized, even when we're wearing a mask, communicating with somebody else becomes a little more challenging because there are a lot of non-verbal cues. So it's not just the language that we use, it's not just what we are saying, it's also the non-verbal cues. So for example, if I'm smiling whilst I'm talking, it's telling you that I'm happy. But if I'm not smiling, that can convey something else. So these non-verbal cues are things that we're constantly interpreting when we're able to see a person's face. And obviously with a mask, these are hidden. So a person with dementia has difficulty in interpreting language. And a lot of times it's the facial expressions which help the dementia person understand what someone is telling them. It helps them understand, it helps them feel supported and cared for. So because if you're wearing a mask and you are, say, for example, taking your loved one with dementia for a hospital visit or something where they're also wearing a mask, it's important to always use a very warm and friendly tone of voice. So a person with dementia may not necessarily understand the language that you're using, but the tone that you speak is something that they will respond to, and it'll help them feel more secure and supported. You may also need to use a much louder, clearer voice than usual because the mask interferes with that. And a lot of people with dementia also have hearing impairment. And a lot of caregivers who are anyways finding themselves having to talk much louder have mentioned that this is something that they're needing to do even more. And this can be quite draining. So it is important to remind yourself to be patient and as empathetic as you can when you're interacting with your loved one who has dementia. Using hand gestures is also something that's helpful because as I mentioned earlier, some of these facial cues are missing. So using hand gestures or just comforting, someone, putting a hand on their shoulder, holding their hand, helping them know that, things are okay, are really small but very significant, important things that you can do. And also we all know about what it means to smile through your eyes. And that's something that's really important. This is something that's, if you use some of these things, it can really help you remain connected whilst communicating with a patient who has dementia, even though you may be wearing a mask. Another thing that a lot of people have found very challenging during COVID is communicating about death and loss. And unfortunately, there have been many people who've experienced loss of loved ones in their immediate families, in their extended families, even friends. And I think this is something that's really impacted everybody, particularly with the second wave of the pandemic. So because people with dementia are often confused, find it difficult to remember things, find it difficult to comprehend information and remember new information, communicating about death, communicating about loss can be very, very challenging. And really, there's no right or wrong in terms of whether you should or should not communicate or how you should communicate. It's a very difficult situation. I know there's a lot of people who've lost close family members and it's been difficult to communicate about this with a person who has dementia. But there are a couple of things that could help you decide how you want to communicate about the loss or whether you wish to do so. So first thing to keep in mind is the stage of dementia. If it's someone who's fairly at an initial stage of dementia, still able to comprehend things, it's going to be important to share about the loss with this person. One of the reasons for this is because, particularly if it's somebody with whom the person has been interacting a lot, the sudden absence of this person may cause a lot of anxiety and distress. And therefore, it's really important to talk to them, mention about the loss. If it's a person who's at more advanced stages, moderate to advanced stage of dementia, it may be very difficult for that person to really comprehend what has happened. They will also forget very regularly what has happened. So it's quite painful. And we used to see this even in pre-COVID times where a person with dementia may have lost their spouse, but keep asking for their spouse. So it's very important to consider the stage of dementia, but also the relationship that the person has with the person who has passed on. If it is someone who the person is very close to, interacts with frequently, then it's probably important to share about the loss with them. If it is someone perhaps in the extended family or a distant friend about whom this person may not really remember or ask about very frequently, then you could take your time to convey about the loss if you choose to. But in all cases, if you are talking with the person about death, it's very important to use very clear, simple language. Again, this is something that's very important when you're communicating with any person with dementia. It's very, very important to use very simple language because the person may otherwise get confused and not really understand what it is that you're trying to say. It's also going to be very important for you to be prepared to keep repeating that information if they ask. And this can be disturbing sometimes for a person. So when you break this information and share it, it's always important to make sure that you have support as well, because this can be very discomforting if someone is asking you repeatedly about someone who's passed on. It's also really important to remember to be as reassuring and comforting as you can to the patient. Always share this information and communicate with them about loss when you are either have someone else to support you and you feel that you're going to be able to provide that sort of time, you're in that frame of mind, and you're able to provide that sort of comfort. So these are some things that are important in terms of communicating about loss. Archana, there was another question that we wanted to ask people. Can we share that right now?
Yeah, sure. So this is the last of our poll. So I'll just share this. Yeah. Can you see it? Everybody can see it? Jayashree, can you see
Yes.
it? Yeah.
So there are many challenges that people providing care for dementia are facing. And we just want to understand from you, what are the most challenging behaviors that you have experienced whilst providing care? These are just some examples. Please do share with us in the chat box about other challenging behaviors that you may be struggling with. But these are quite common challenges: sundowning, repetitive questioning, aggressive behavior. Are these some of the challenging behaviors that you've experienced whilst providing care for your loved one during COVID? Do also share about any other challenging behaviors that you may be struggling with.
Yeah, so there are some responses coming in the chat. So I'll just read that out. So somebody is talking about incontinence, withdrawal, resigned. Yeah. So please do put in your comments. Please do put in your responses for the poll question. We'll be closing the poll shortly. So not having medicines is another response. So, obsession with motions. Laziness. Okay. Compulsive buying, difficulty in changing clothes. So some of these are
So a lot of issues
responses we are
around
getting.
challenges around providing
Self,
personal care and extending personal care to the
self-care.
person who has dementia.
Yeah. So this is very interesting. Compulsive buying. So that's something. False is another one. So yeah. Okay, so I think we'll end the poll, Jayashree, and I'll just share the responses.
And I think so clearly repetitive questioning is something that most people are struggling with. And I think this is something that we've seen, really understand that is very difficult because particularly with the lockdowns and the COVID restrictions, the fact that we can't actually go out and get the sort of respite as caregivers makes it doubly challenging because repetitive questioning can be really, really difficult for caregivers since and particularly more so at this time when they're unable to really get away from the situation even for a small amount of time. So just before we get into answering more questions and discussing about some of the challenges that you've been facing and some of the ways in which we can probably address these, I just wanted to highlight some of the things that are really important for providing dementia care during COVID. So first and foremost, follow COVID safety measures as far as possible. This is really, really important. But one of the challenges, and I think this has become it's difficult for everyone right now, and more so for people who have a dementia family member with dementia, is how to spend quality family time. Um, under normal circumstances, moving away for some duration, be it to go out for a walk, be it to take a break to do something else, even to go to a store to buy something. If you are actually working, the time that you spend out working in an office, all of these are time points at which caregivers get respite from their caregiving duties. And one of the challenges that people have really struggled with during COVID and the pandemic is really with taking out time for themselves during caregiving. And uh, even though the family is there all the time, uh, spending quality time with family is becoming more and more challenging. So one of the things that can you must try to see if you can engage with the person who has dementia at some point in the day. A lot of people say that they're really overburdened with different, basic managing personal care, managing, household chores, and spending some time outside of this is really almost seems burdensome. But if possible, try to see where you can involve the person with dementia in some simple activities. If there are younger children in the family, for example, perhaps playing a game. If there is some time when you could watch something on TV together, watch something together. If they enjoy music, music is wonderful. Um, After a series of chores, maybe put on some music, sing. We had wonderful experiences of people singing, and this is really it's really helpful because it helps to increase the family bonding, and it also helps it helps to uplift the mood during this time. So try to engage the person in different kind of activities. Another thing is, where possible, engage the person with dementia in some or the other household activity that is safe. This again may be possible only for people at the initial to moderate stages, but even something as simple as folding clothes. Now, it's not the quality of what is being done, but it is, encouraging them to do an activity that they were previously doing, may have been previously doing, which is safe. So encouraging them to do that. Or perhaps if it is a lady who's no longer able to cook independently, but perhaps make something with the family that doesn't involve direct use of the gas. So simple activities like this, if you can incorporate those into a daily routine, that's really, really important. But at the outset, again, things that do not work with dementia, just because a person is unable to really comprehend the situation around them, um, are arguing with the person about what they need to do. Instead, it's really important to provide reassurance. Someone had mentioned incontinence. This can be very, very embarrassing for the person who has dementia. It can be very frustrating for family members. But it's important to remember that this is part of the illness, and you can provide reassurance and work with a toileting, a routine to take them to the washroom. That's one way to help reduce episodes of incontinence. Another thing that came up, which is hugely challenging, is repeated questioning. And sometimes it's really important to try and understand what it is that the person is trying to communicate. Because as I mentioned earlier, a person with dementia really loses their ability to express themselves. So perhaps the question that they're asking, which could be very irritating at times, uh, is their attempt to ask for something else. So so as a family, it's sometimes important to try and understand what is it that this person is trying to say when they're going on asking this one question over and over again. And sometimes the best thing to do is really distract the person at this time. Distract them with some sort of some other activity. Distract them with something else that they enjoy. So, one of the first things that we often do with people who have dementia is really pull up a list of things that they enjoy, things that they don't like, and we try and keep this with us to help um, to use as distraction techniques when something like repetitive questioning becomes very difficult. Um, I also just wanted to highlight, and because this is a caregiver support group meeting, the importance of taking out time for yourselves as caregivers. Caregiving for someone with dementia is really challenging, and you can feel burnt out easily. Right now, people are struggling with working from home, managing various household responsibilities whilst providing care. And this can make you vulnerable to other mental illness, such as depression, anxiety. So it's important to acknowledge when you're experiencing burnout. And some of the signs of caregiver burnout are feeling trapped in the situation, having a lot of concerns about the future. If you're experiencing sleep disturbances, loss of appetite, or uh, increase in your appetite, where you're compensating by eating, all of these could be signs of burnout. Increased irritability, anger, and a sense of being hopeless or helpless about the future in the current situation are also signs of caregiver burnout. And also, guilt is something that we see a lot in people who are providing care for dementia. So, if you're experiencing any of these, do reach out to a professional, do reach out to other friends or families who you could talk to about this, because it's very, very important to seek support for caregiver burnout. Some typical, very, very simple things that you can try to do to take care of yourself are, particularly during this pandemic time, remain connected, follow a routine. Try to, it's hard sometimes when a person with dementia is experiencing disorientation, needs to get up frequently and be supported to use the bathroom at night. But as far as possible, try to follow some sort of sleep hygiene for yourself, and try to incorporate some amount of exercise and diet into your daily routine. It's very important to remember to share caregiving duties. So if there are people whom you could give a particular task to, allocate that task. Take your break. There may be one primary caregiver, but it's important for everyone else in the family to also chip in with caregiving responsibilities and duties. Also, feel one of the ways to feel more prepared about the future is to prepare for contingencies, for emergencies. And it's really important to recognize any of the signs of stress that I spoke about earlier so that you can seek help from a professional and really reduce any risks of developing other mental health related illness, or even just the psychological distress that providing care puts upon a caregiver. So with that, I'm going to stop sharing, and Archana, if there are questions that people have shared, maybe we can just start taking some of those questions.
Yeah. So thanks, Jayashree. This was a very informative presentation and some really good insights. I hope uh, people are able to relate to it. I'm sure they are. So I was looking at the questions, and there are quite a few of them. I think the common theme is people are having a lot of challenges with personal care, convincing their family member to bathe, to eat, incontinence. Um those are some of the. I'm seeing a lot of questions around personal care. So I'm going to summarize the questions and take them up as I see the themes.
Sure.
So would you like to start with that?
Yeah, and I know that this can be very, very challenging, very frustrating. Um, one of the things that's I think is really important when it comes to personal care is and particularly a lot of people I think face challenges with bathing. This is something that is very challenging for caregivers. And it's something that, I just want to highlight that, this is difficult not only for the caregiver, but also for the person who is being cared for. Now, bathing an adult is not something that it's not something that we're comfortable with. We always, so therefore at the beginning, it's very important to understand that this is that when you're in a bathroom, you feel more vulnerable. You're not used to being bathed. It's important to remember that this is a situation in which the person with dementia may feel threatened, may feel insecure. It's uncomfortable, and so it's important to understand why this is challenging for the person who has dementia. It's also important to try and see how you can therefore maintain that sort of dignity whilst you're engaging in personal care, and how you can make it more of a shared activity than something that you are completing for that person. So a lot of caregivers struggle with this because there are so many things that you have to do in the day, and the thought of actually having to get the person who has dementia to the bathroom to give them a bath when they're going to struggle, resist, get angry, become aggressive is really challenging. So firstly, incorporate this activity into a time of the day where you are more calm, where you have that time. That it's very, very important. Prepare yourself for that resistance. Um, then make it a shared activity. Don't. It's important to discuss dialogue with the patient, even though they may not, really understand this. But prepare them for, the fact that that you're going to take a bath together. Ask them, can we make it a request, not don't impose it upon them. I know this is something that we do with children, and we get away with it and it works because they're children. But when we're doing this with an adult, really have to be very sensitive to the fact that this is not something that that they're used to, and it's very, very awkward. So try and ask them whether they're ready, whether we can do this together, whether you can help them, whether you can assist with them. If they're not, simplify the process of bathing. Now, I know it's something that we would ideally like to do every day. It's a struggle. If it's not possible to bathe every day, maybe you could use a sponge wipe, give them, towel to do this, but simplify the activity. If they're struggling with using a mug and a bucket of water, if you have access to a shower, try to use that. But another thing that's really important to do is, especially in advanced stage of dementia, is a person is, that they're scared of water. So prepare them for when you're going to put the water. So these are some very simple tips. See if you can use this whilst if you're struggling with just basic personal care, but be very flexible.
Yeah. And I think there's a related question which is very interesting, is that the person wanting to get rid of the caregiver. So, making excuses to get rid of the caregiver. So I think maybe you can throw some insight into why that happens, because we hear that a lot when we provide caregivers. There are challenges in the person settling in and getting adjusted to this, and also for the patient, the person with dementia, to accept somebody to supervise or even help with the whole personal care process is very challenging, I think. So.
Yeah, and we see this a lot, that people refuse the help or try to get rid of the caregiver. One thing that's important to remember is try and, as far as possible, keep the wishes of the person in mind. So, for example, if there are multiple people in the family, see whether and you're providing that personal care, see whether there's one person the dementia patient is more comfortable with versus someone else. See if they can be responsible for, providing that sort of personal care. We've seen in some cases families prefer that the son, for a male member that they prefer that their son assist them with personal care versus their wife. So if that makes a difference, look into that. Also, we've seen that there may be a lot of care dementia patients are more open to receiving support from someone outside of the family, because then it preserves that sense of dignity. So sometimes just having an attendant or else coming into support with these sort of personal care needs uh, is very helpful. It not only takes away the stress from the family, but it also takes away that embarrassment from the person who has dementia.
Yeah. So, Yashvi, there's another question about vaccination for a dementia patient, and also about the fact that regular blood tests for a dementia patient, how to administer that, because they get scared of the needles, or uh, so any comments or suggestions on that?
Yeah, this can be really really challenging as well. And I think the way we've seen that it's worked is where the person who's doing the the blood testing or the vaccine is sensitive to dementia. Again, remember that this is a person with dementia doesn't know what is a may not understand or fully comprehend what is a vaccine, what is a needle. It's important to prepare them through the process. So, a person who's doing that blood test needs to. It's about helping them understand what is going to happen next. So, helping them understand that this may prick, this may hurt a bit, but it's okay. It's nothing they need to be scared about. So, really being sensitive and helping them, the person with dementia, understand what is going to happen. So that's really, really important when going in for either vaccine or blood tests.
Okay. Then there are some questions around, how do you detect dementia, and what are the screening or tests available? So I think, would you like to comment on that? Because I'm seeing some questions around that.
So there are various tests that can are used to screen for dementia. Um, and we do a lot of dementia screening and assessment. It involves taking a detailed history of the patient, really trying to understand where how a person has deteriorated. There are also psychological tests that we use that help to objectively identify where a deficit is present and where it is just a natural uh, part of any sort of change may just be a natural part of aging. And then, of course, there are other scans which help to your MRI scans and all, which really help to see where some sort of degenerative processes are happening within the brain. So it's usually a combination of these various tests that help to support a clinical diagnosis of dementia and really understand what stage the person with dementia is at.
Mhm. Then there is a theme around activities and the person, especially now if everybody is sitting at home, and so there's a restricted movement also probably for the person, and then there's laziness and dullness. So how do you make the person more energetic during the day? Is the question. So.
Yeah, that's something I think that's been really, really challenging during COVID. Um, and definitely one of the things that's important is try to see if you can maintain some sort of a routine with some activities in the day that are important, that are enjoyable, pleasurable activities. Engage with the dementia patient in these simple things. Maybe simple activities like playing a game, reading a newspaper together, watching a TV serial together. There are specific cognitive stimulation activities that we also provide. In some cases where a person has initial to moderate stage dementia, we've actually been doing these online right now. These are certain ways in which these are evidence-based programs which really help to slow down the progression of dementia, as well as keep the person more engaged through the day. So I think one of the biggest most important things is to really see how you can incorporate some activities into the day that are fun um, with the dementia patient.
Yeah. And I think there's a question on where to contact for professional help, any particular person, and also about my mom needing counseling to handle him. So, just to share with all of you that we do provide professional caregivers for dementia who are there for physical care, and the therapy sessions are done by our counselors and specialists who are available. Currently, we have been doing it since the lockdown. We have been doing most of it online, but now we are just about to resume the in-home sessions also. And caregiver counseling and enablement. Jayashree, you want to talk about that a little bit?
Yeah, so we
Why
what
it's important? I think the reason, I think we have a very good program around that. So what made us make that program? I think that
right.
will
So
be nice to share.
absolutely. So we one of the we understand that caregiving is challenging, and a lot of family members prefer to provide support and care for their loved one with dementia, but it's a first time experience, and therefore knowing what to do and how to do it can be challenging. There are also various behaviors that we call challenging behaviors that are symptoms of dementia that come up during the course of dementia that are very difficult to deal with. And we have a caregiver enablement program that basically involves educating and training family caregivers to provide better care and to provide and really understand how they can deal with some of the behaviors which they're finding very challenging to deal with or are struggling with. We've been providing this program online. We also now hope to resume it by in-person visits where a trained professional will share some tips tailored to each individual, and really help family members understand how they can overcome some of the challenges that they're facing whilst providing care.
Yeah, yeah. And I think I would just like to add to that the caregiver program also, it focuses on how to deal with the person, on the soft skills part of it, and how tactfully or using certain techniques, which is very easily said than done, because when you are in the thick of things, it can be very daunting. But that's where this interaction with a professional and sharing your experience, and then we help them change the track or modulate it. So these programs are really helpful. And I think somebody's also mentioned a very interesting comment that drawing boundaries with dementia patients is important for caregivers, and the patient can be very demanding and controlling. So you have to balance it out. Like, I think you talked about that in one of your slides. So uh, not to have caregiver burnout while caring for a person with dementia. So,
Uh, I think that's really well said. A lot of caregivers feel that it's their duty to provide 100%, to be on the job 100% of the time, but it's equally important to take care of yourself whilst you're providing care, and that will actually enable you to become a better caregiver. So absolutely, I mean, I think thank you to whoever shared that, because I mean, for all the other caregivers out here, that's a really important piece of advice from someone who's providing care.
yeah. Yeah. So I think there's one last question, and which is basically around at what age can dementia happen, and can it affect younger people in their 40s and 50s?
So yeah, that's a very important question. Typically, we see that dementia sets signs of dementia or can be noticeable around 60, 65 upwards. It's Old age is the primary risk factor for dementia. But it is a risk factor. It is not a cause of dementia. Not everybody who ages gets dementia. It is a disease. I mentioned that there were many types of dementia. There are certain variants and certain forms of dementia which are more common in lower age groups, so around the 40s or the 50s. So, for example, we see a lot of people with Parkinson's dementia who may be younger, people with Lewy body dementia or frontotemporal dementia who may be younger, in their 40s to late 50s as well. So yes, it depends really on which type of dementia. By and large, it is in older adults, and the risk kind of doubles with every 5-year increase in age upwards of 65. But it is possible that it happens in younger adults as well.
Yes. Any other questions? If there are any last couple of questions, we are almost running out of time, but we'll be happy to address any questions which are not covered in our discussion so far. So please do type in your questions. There was one question around aphasia and not being able to communicate with a person who has aphasia. So you want to comment on that, Jayashree?
Yeah, I think this is something that would require a lot more personal, individual, tailored understanding. It is really important to understand, to kind of look at the individual as a whole and see then specifically what the family can do to work with this individual. So, I mean, I think if this is something that we could take up, I mean, if someone could contact us separately, then we can actually work with them to help them understand that better.
Yeah. There will be some questions or some cases which are best discussed in an individual capacity. Okay, so just a second. I see some last few questions. Okay. Shall we tell our dementia loved one of the loss of their best friend? I think we discussed that, but and then there's a question around resources that can be read. So I think there's a lot of material on the internet on dementia, but if you also refer to our Samvedna Senior Care's blog site, you will see very good content and some very good articles around how to deal with a person with dementia. And all these and support group meetings are getting recorded and they are available on our YouTube channel. But there are probably other literature or sites available for educating somebody on dementia. Jayashree, you want to comment on that?
Yeah, there are a lot of information sources available. I think there's a Alzheimer's Association. There's a Alzheimer's Association International has a lot of very good resources. We're actually involved also ourselves now in a project which is looking at collating different resources for caregivers. In the next couple of months, that's something which we will be able to put details up of on our website. But do look at the blogs that are on our website for a lot of tips on caregiving and suggestions that we've collated from having worked with people who have dementia and their experiences of caring for people with dementia.
Okay, so in case there are any other questions, we have run out of time. But a lot of you have joined today, and thank you for coming in and sharing your experiences, as well as we hope that we have been able to address some of your questions, if not all. And as Jayashree mentioned, we have some very good programs for dementia care. They are for helping the family, the caregiver, whether it's our caregiver or you have a caregiver, and we can provide training or counseling to that person. Then we have special interventions and programs which are very useful in initial stages of dementia. So I think in another session, maybe we'll talk about early detection and how that helps a lot. And for COVID times, I hope we do not have any other lockdown. So I hope as you will be able to take your loved ones out for a small walk in the park soon, so that at least there is some physical energy, which is dissipated. So in case you still have questions, or if you want to learn more about our services, I have already shared the contact ID. You can email to us, or you can also call us at one of these numbers, which we'll just share with you. It's probably there in the in our flyer. And please don't hesitate to write to us, and keep looking out for these meetings, which happen, like I said, once every 6 weeks. So we'll probably have another one in the end of July. So please do log in, and you can share with your friends also if they are looking at information or support for dementia care. So thank you, Jayashree. And if you have any last thoughts, please do share.
I think thanks, Archana, and I think it's really important to share experiences that you've had with challenges caregiving. If there are any specific topics or areas that you would like us to take up during these support group meetings, anything that you would either like to know more about, or if there are experiences which you would like to share that you think would be of benefit to other caregivers, do reach out to us with those as well. And we'll see how we can incorporate them into our next future support group meetings.
Great. So thank you, everyone, and have a great weekend, and stay in touch. We also do share our blogs and other information via email. So I hope we will be subscribing you to our newsletter, and in case you can watch out for that space also, for getting to know more about some of the work or some of the information around dementia. Thank you, everyone. Thanks, Jayashree, and have a good evening, all of you. Thank you.